Mr. Sergeant at Arms.
All persons not entitled to the privileges of the floor under the rules of the Senate must now vacate the chamber.
Please rise for the invocation by Pastor Kyle McDaniel, Capital Commission, and remain standing for the Pledge of Allegiance.
Let's pray. Our Father, thank you for your love and mercy. I am grateful for these leaders, believing that you have raised each and every one of them for this moment to face the countless challenges of our day. May you bless them with divine wisdom that will allow each of them to choose what is best and good for our state and their districts. Lord, I ask that you would guard their hearts as they lead, saturate their words with grace as they speak, and give clarity to their minds as they cast their votes. Each leader here today carries upon their shoulders countless burdens that often go unspoken. They are here on this cold day in Frankfort, while family remain at home and responsibilities are set aside so they can serve their neighbors and districts. May their actions be pleasing in your sight and contribute to the well-being and improvement of our great state. In the end, Lord, may we all seek to do your will above all things. May your glory be our central focus, and may the hope of Jesus be revealed across every county, every town, every home, and every heart across our beloved Commonwealth. In the name of your glorious Son we pray. Amen.
Amen. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Appreciate it. Madam Clerk, please call the roll.
Senator Berg, Senator Boswell, Senator Carpenter, Senator Carroll, Senator Chambers Armstrong, Senator Clemens, Senator Deneen, Senator Douglas, Senator Elkins, Senator Funke Fromeyer, Senator Girdler, Senator Givens, Senator Herron, Senator Higdon, Senator Howell, Senator Maiden, Senator Mays Bledsoe, Senator McDaniel, Senator Meredith, Senator Mills, Senator Neal, Senator Nemes, Senator Nunn, Senator Rocky Adams, Senator Rawlings, Senator Reed, Senator Richardson, Senator Smith, Senator Stivers, Senator Storm, Senator Thomas, Senator Tishner, Senator Webb, Senator West, Senator Wheeler, Senator Williams, Senator Wilson, Senator Wise.
Carpenter's here, Neal is here. All members being present, quorum is declared, Senate is authorized and prepared to do business. No need for excuse of absent senators, so we'll go to approval of the journal. Senator from Taylor.
Mr. President, I move that the journal from Wednesday, February 4th, 2026 be approved as written.
Without objection, the journal from Wednesday, February 4th, 2026 is approved as written. Senator from Taylor.
Thank you, Mr. President. We want to welcome all those that are watching us on KET as well as live stream. I do know, Mr. President, in the annex from our viewing room, we have a number of constituents from the Bowling Green, Warren County area, from the Bosnian community there. We'll be doing a Senate resolution. The senator from Warren will be presenting that later during our proceedings, but wanted to welcome them. I know many of them are watching on behalf of the Kentucky State Senate. We welcome you and any other guests that we have that are with us today, Mr. President.
Thank you, Senator from Taylor. Before we go any further, I'm going to recognize the Senator from Grayson.
Thank you, Mr. President. The Clerk of the House is here to communicate with our Senate.
Madam Clerk.
Mr. President, the House has passed House Bill 4 and respectfully request concurrence of this honorable body.
Thank you, madam. Now we will go to second reading of bills on the calendar. Mr. Clerk, you have a report. Please proceed.
For Thursday, February 5th, 2026, second reading of bills on the calendar, Senate Bill 18 with Senate Committee Sub 1, an act relating to the practice of podiatry, Senator Richardson. Senate Bill 33 with Senate Floor Amendment 1, an act relating to recovery residences, Senator Thomas. Senate Bill 85, an act relating to designating a special needs trust to receive state-administered retirement benefits, Senator Webb. Senate Bill 132, an act relating to massage therapy, Senator Funke Fromeyer.
Does that conclude your report?
It does.
Those bills and resolutions having received their second reading are now in the possession of the Rules Committee for further action. Next order of business would be report of committees. Mr. Clerk, do you have a report?
I do.
Please proceed.
Economic Development, Tourism, and Labor Committee has met and reports Senate Bill 136 should pass. Also, the Economic Development, Tourism, and Labor Committee reports Senate Bill 183 should pass. The Education Committee has met and reports Senate Bill 2 should pass. Education Committee also reports Senate Bill 4 with Senate Committee Sub 1 should pass with the Senate Committee Sub 1. And Senate Bill 71 should pass with Senate Committee Sub 1 and Senate Committee Title Amendment 1.
All those bills and resolutions. All those bills and resolutions having received a favorable committee report shall now be considered as having their first reading and are to be placed upon the calendar. Next order of business would be introduction of new bills and resolutions. Mr. Clerk, please report.
New resolutions. Senate Resolution 79, a resolution adjourning the Senate in honor and loving memory of Joseph Hardin McFarland, Senator Wilson. Senate Resolution 80, resolution adjourning the Senate in honor and loving memory of Jeremiah Parsons, Senator Wheeler.
Is that all?
It is.
That's good. Thank you, Mr. Clerk. Next order of business would be orders of the day. Senator from Taylor.
Thank you, Mr. President. Mr. President, I move that Senate Bill 5 be taken from its place in the orders of the day, read for the third time by title only, and placed upon its passage.
Mr. Clerk, if you would, please report Senate Bill 5.
Senate Bill 5, an act relating to Kentucky-grown agricultural product procurement, Senator Howell.
Senator from Taylor.
Yield to the Senator from Callaway for explanation of the bill.
Senator from Callaway.
Thank you, Mr. President. Speak on the bill. Thank you. All of us, when we started to school, whether it was at London Elementary many days ago or in Casey Elementary where I started out, we learned about eating right. All of us can remember studying the food tree and how many doses of fruits and vegetables and everything else we were supposed to have. It's no secret that all of us know that we need to eat healthy. Some of us might need to learn that lesson a little better. But one of the things that we really want to focus on is making sure our children eat healthy. This bill takes a good, strong step toward that. I would like to thank Commissioner Jonathan Schell and the Kentucky Department of Agriculture, who took the lead on this, along with all the cooperation and help and support from the Kentucky Department of Education and a lot of the K groups like the School Board Association in crafting this bill. Mr. President, this bill is really short in length. It's about a half a page long, but I think you'll have great depth and breadth as we move forward with this. Now, I'm not going to sit here and promise you that when we start growing broccoli in Kentucky that our kids are going to eat it any more than they did with broccoli from California or wherever we get it now. But one thing I can tell you is it'll be fresher, it'll be more nutritious, and the money that we already pay to purchase this will be going back into our own communities to support our ag producers here in Kentucky. With that, I would be happy to answer any questions. If not, I move for passage of Senate Bill 5.
The matter before the body is passage of Senate Bill 5. Are there any members seeking recognition for the purpose of question or discussion? Seeing none, Madam Clerk, please call the roll.
Senator Berg. Senator Boswell. Senator Carpenter. Senator Carroll. Senator Chambers Armstrong. Senator Clemens. Senator Deneen. Senator Douglas. Senator Elkins. Senator Funky Fromeyer.
Senator from Campbell, please cast your vote, then explain, limited to 3 minutes.
Thank you, Mr. President. I would like to vote aye. And I would also express appreciation for the senator from Callaway and his diligence and persistence to work so closely with the agriculture community and especially our Commissioner Shell. The recognition during our Make America Healthy Task Force, which many in this room provided input and subject matter, people that could really truly testify. And this effort that our senator from Callaway has recognized, rural prosperity is absolutely possible in Kentucky. We can lean into the opportunity to grow your backyard, raised bed garden, even urban prosperity is possible. Raised bed gardens in our community parks, in our county, our city parks. We really truly have the ability to lean into food as medicine, and this beginning more our preschool through 12th grade and getting procurement right to get our cafeterias serving again really wonderful fresh whole foods, and how about making them Kentucky grown foods. So I thank the senator from Callaway and I vote aye.
Senator Girdler. Senator Givens. Senator Herron. Senator Higdon. Senator Howell. Senator Maiden. Senator Mays Bledsoe. Senator McDaniel. Senator Meredith. Senator Mills. Senator Neal. Senator Nemus. Senator Nunn. Senator Rocky Adams. Senator Rawlings. Senator Reed. Senator Richardson. Senator Smith. Senator Stivers. Senator Storm. Senator Thomas. Senator Tishner.
Senator Oldham, please cast your vote, then explain, limited to 3 minutes.
Mr. President, I'd like to cast an aye vote and just commend the senator from Callaway for his work on this bill. I was able to participate in the MAHA task force during the interim, although not a member, and just want to thank the chairman of that task force, the senator from Campbell, and her work on this effort. This is so important to move Kentucky in the right direction. We learned in that task force about so many diseases that are now affecting children younger and younger. And if we can start redirecting nutrition as a form of medicine, as the senator from Campbell mentioned, we will turn the tide on the health issues that we see in Kentucky. And I'm so grateful for the leadership of this Senate to make this a priority piece of legislation for this session. Thank you.
Senator Webb. Senator West. Senator Wheeler. Senator Williams. Senator Wilson. Senator Wise.
There being 38 members voting and 38 yeas, no nays, Senate Bill 5 is passed. Senator from Taylor.
Mr. President, I move that Senate Bill 73 be taken from its place in the orders of the day, read for the third time by title only, and placed upon its passage.
Mr. Clerk, if you would, please report Senate Bill 73.
Senate Bill 73, an act relating to tallow-based cosmetic products. Senator Howell.
Senator from Taylor.
Mr. President, I yield back to the senator from Callaway for explanation of the bill.
Senator from Taylor, or Callaway.
Thank you, Mr. President. Speak on the bill.
Please proceed.
Mr. President, we have a lot of people that are engaged in a lot of home-based businesses throughout the Commonwealth of Kentucky over a wide array of products. One of the things that we already do in the state of Kentucky is allow people that are doing home-based processing to utilize beef tallow for food consumption products. This bill would expand that out to allow people engaged in this area to use beef tallow to make and home process cosmetic products. If there's any questions, I'll be happy to answer them. If not, I move for passage of the bill.
Matter before the body is passage of the bill. Any member seeking recognition for the purpose of question or discussion on the bill? Seeing none. Madam Clerk, please call the roll.
Senator Berg. Senator Boswell. Senator Carpenter. Senator Carroll. Senator Chambers Armstrong. Senator Clemens. Senator Deneen. Senator Douglas. Senator Elkins. Senator Funky Fromeyer. Senator Girdler. Senator Givens. Senator Herron. Senator Higdon. Senator Howell. Senator Maiden. Senator Mays Bledsoe. Senator McDaniel. Senator Meredith. Senator Mills. Senator Neal. Senator Nemes. Senator Nunn. Senator Rocky Adams. Senator Rawlings. Senator Reed. Senator Richardson. Senator Smith. Senator Stivers. Senator Storm. Senator Thomas. Senator Tishner. Senator Webb. Senator West. Senator Wheeler. Senator Williams. Senator Wilson. Senator Wise.
There being 38 yeas, no nays, Senate Bill 73 is passed. Senator from Taylor.
Mr. President, I thought we'd have some more comments on that bill, but maybe some don't want to tell what they're using in the mornings on their facial products or not. With that, Mr. President, I move that Senate Bill 12 be taken from its place in the orders of the day, read for the third time by title only, and placed upon its passage.
Mr. Clerk, if you would, please report Senate Bill 12.
Senate Bill 12, an act relating to medical provider coverage and Level 4 trauma centers. Senator Meredith.
Senator from Taylor.
Mr. President, I yield to the Senator from Grayson for explanation of the bill.
Senator from Grayson.
Thank you, Mr. President. This is a health care bill. Now, I found that ironic in that when I came to Senate back in 2017, when Renee Shaw interviewed all of us new legislators, she started my interview with, "I see you have 40 years health care experience. I guess you have a health care agenda." I said, "No, I do not. I have purged all that gray matter from my brain, and there's other things I want to work on." I said, "Well, such as what interests me most is trying to eliminate poverty in rural Kentucky." But as you look into it, I mean, the reasons that we have poverty are the lack of resources that other communities have. And as most of you know, in rural communities, their hospital is a major economic driver for them, many times the largest employer. We had a testimony in summer before last from the Cabinet for Economic Development, Secretary Jeff Knoll, and without prompting for me, he said, "You know, if you don't have a hospital in your county, it's almost impossible for us to recruit industry to your county." And you know the pressures that rural hospitals are facing right now. You know, with the loss of 340B funding, with the projected cuts on Medicaid from HR 1, that has been projected as many as half of our rural hospitals could close. It's never become more precarious, and the financial position of hospitals are declining each and every day. And unfortunately, there's a real dichotomy in healthcare right now, in the haves and have not. And unfortunately, rural communities, it falls in the spectrum of has not. What we're talking about specifically today is trauma care. There are 4 designations in Kentucky, The top being obviously level 1. We only have 2, University of Louisville, University of Kentucky. At the other end of the spectrum is a level 4. And the expectation for these centers is to assess the patient, stabilize them, transfer them. We passed legislation back in 2008 to establish a statewide trauma network. Since that time, we have not appropriated a single dollar to it. And the impact of that is we lose over 5,000 citizens a year to trauma-related industries, and unfortunately, and most pronounced in rural Kentucky. We never take the time to take what the cost of that is. We're 45th nationally in trauma-related deaths, in a good measure because of lack of those resources. We need to build that network, but I'm not here to ask for an appropriation today. I'm asking for relaxing some standards to expand our network. We have only 20 level 4 trauma centers in Kentucky. Again, you know, all those are rural. In the western state is a virtual desert. It's not there. But we have 75 rural hospitals. You have to ask yourself, why do we only have 20 level 4? Well, in part because it's expensive to adopt the standards, purchase the equipment, have the staffing in place. So they're just an ER. Now in Kentucky, in every state, if you're a hospital, you have to have an emergency department. And do you know what the standards are for those emergency departments? Very simple. It says you have to have a nurse that can assess the patient upon arrival. And you have to have a doctor on call. And we want to talk about the standard of care. What this bill simply does is align national standards, because for trauma centers, those are developed by the American College of Surgeons, and they themselves recognize that it's a challenge in rural Kentucky to have physician coverage. So it's acceptable to them that that service can be provided by a mid-level practitioner under the supervision of a physician. But Kentucky's laws does not make that distinction. So as a result, we have 55 hospitals that have no designation, but would like designation. Let me read a letter to you from those CEOs. This is from Crittenden County Hospital. I'm writing as a CEO of Crittenden County Hospital in Marion, Kentucky. Senate Bill 12 provides necessary statutory clarity for level 4 trauma centers to utilize nurse practitioners and physician assistants under physician supervision. Our emergency department safely operates under this model and works diligently to ensure timely transfer of patients when a higher level of care is required. Under current statute, hospitals like ours are effectively unable to participate in the state trauma system solely due to our staffing model, despite providing appropriate emergency care and meeting the intent of level 4 trauma services. Given the realities of rural staffing, this creates an unnecessary barrier where hospitals that would benefit most from state guidance and coordination are excluded. Senate Bill 12 would allow rural hospitals to participate appropriately through level 4 certification, providing clear oversight, approved processes, and improved coordination that ultimately supports safer care and more efficient transfers. In addition, studies have shown that hospitals that have level 4 designation, the overall standard of care is improved. It raises the tide for everyone. Now, the only ones that take exception to this, which I find kind of ironic, is our local American College of Emergency Physicians. And I know most of you received a letter from them. And its first statement says, Senate Bill 12 would allow level 4 trauma centers to be staffed without on-site physicians relying solely on nurse practitioners or physician assistants. That's not true. There still has to be a physician who's oversight for that practitioner. Can be on site, but also can be remote through telemedicine. That's acceptable. And what's ironic about this is a statement, a policy statement for the American College of Emergency Physicians back in 2023, and it says, we acknowledge that there are currently workforce limitations in specific CMS designated facilities in which supervision of a PA or nurse practitioner by an emergency physician may be provided off-site by telehealth means as follows. But now they object. And I said the group that set the standards, American College of Surgeons, say this is an acceptable model. But our law says to the contrary. Now, some people are interpreting this as we're doing this instead of a physician. No, we're not. It doesn't say that. What it does is allow us to maximize the use of our human resources in those facilities to be all they can be. I can assure you every one of those 55 hospitals do not want to be just a nurse there to triage and a physician on call. Their goal could ultimately be the level 1, but we know that's going to happen. They just want to be the best they can be and have the resources to do that, and why would we deny them that? 20, level 4 in Kentucky. Our neighbor, West Virginia, to the east, is 34, and they're half the population of Kentucky. Also, this acceptable standard in Tennessee, in Ohio, Missouri, South Carolina, but we're going to be different. We're going to stand out. We stand out. We're 45th in the nation trauma-related deaths, and it's worse in rural Kentucky. No one's ever going to convince me that doing this is a lower standard of care, because the other standard of the care is, again, a nurse on duty and a doctor available by call. This raises the standard of care, particularly for rural communities. This doctor goes on to say that Kentuckians deserve the same standard of emergency trauma care as those in urban communities. I could not argue that point more. But why don't we have that? Because of the payment inequities that rural communities have to face? Every session that I have been here, and this is my 9th session, every session I present a bill to help rural health care by reducing bureaucracy, increasing access to care, reducing cost. Doesn't cost our state a penny, and we say no. How much longer is rural Kentucky going to be treated as a second-class citizen? We deserve this. It's not a compromise in care. This is needed in our smallest communities, in our most financially distressed communities. So with that, Mr. President, with no question, I ask for approval of Senate Bill 12.
The matter before the body is passage of Senate Bill 12. Are there any members seeking recognition for the purpose of question or discussion on the bill? Senator from Jefferson 26.
Speak to the bill.
Please proceed.
Thank you, Mr. President. I hope the senator from Grayson knows how much I respect him. We, however, have a significant fundamental disagreement about only half of this bill. I want to tell you, half of this bill is my dream bill. My dream bill. I have worked in trauma, not mental health trauma, physical trauma, since I was in my 20s. I started the Department of Emergency Radiology at University of Louisville, where we take all day and all night, all comers from our side of the state, and we try to keep them alive. That is our job. And I will be honest, it is a stressful job. It's a high anxiety job, because you are literally dealing with life and death. You've got patients in front of you who are exsanguinating. You have decisions that need to be made in moments. So the idea of expanding our statewide trauma network so that we can communicate with healthcare providers in every corner of this state, real time, to save lives, is a dream of mine. This is something I have wanted. Well, I think the original bill was passed in 2008, and I can remember that bill. I can remember being excited about that, what that was going to do. But it honestly didn't do anything because it had no funding. So the idea that we're actually going to fund a trauma network where the goal is to improve response times so that you can save lives. That's the whole entire goal. is to get either the provider to the patient or the patient to the provider in a facility that is able to offer what that patient needs as quickly as possible. Unfortunately, this part about having non-physicians in level 4 trauma centers is for me and for the trauma network that I have worked my entire life in unacceptable. It is unacceptable because time is life. And to transport a patient to a facility where you know you do not have a medical doctor to respond is a waste of time. Everybody in the U of L Healthcare Trauma Network would tell me, bypass that facility and go to a facility with a doctor. Because you don't know, it may not just be a central line. It may not just be a chest tube. It may be something far more complicated and something that a nurse practitioner will not be able to handle on their own. Guys, I have done this for years, and every time it's terrifying. Every time you go in to room 9 where you know you have the best trained, best educated people in the state, it is still terrifying because you have horrendously damaged, hurt people in front of you. Your job is to try to figure out what is going to kill them first and how do I stop that. That requires years and years and years of understanding pathology, understanding, I mean, the physician that spoke in favor of this bill in committee had the hubris to tell me after that committee that he himself could personally take any nurse practitioner in this state that was worth her weight in gold and train them in 2 years to do everything he does. Well, then there's something wrong with your extent of the knowledge base that you're supposed to have, because that's not possible. That is not possible. It takes years and years of experience. And I know we need more level 4 trauma centers in the state. We need more healthcare providers in the state. We need more hospitals. We need more providers at all levels. There's no question about that. But guys, if it's your mother, your father, your child, your brother, or your sister, do you really want them transported to a trauma facility where there is not a doctor? And honestly, the senator from Grayson says response times. Right now, you can have a nurse in your ER and a doctor on call. That doctor has a response time to be in that facility. At my hospitals, in my rural hospitals that I served as chief of staff at, that was a 30-minute response time. If they were not there in person in the ER in 30 minutes, they were going to get sanctioned by me because I needed them there and they were supposed to be here. Here we're talking about supervision that has no definition. We haven't defined it, guys. So we're saying, yeah, you could supervise what we call in-house, which means you're in the hospital. No, we're not requiring that. You can supervise with a response time. You have to be able to be in the hospital in 30 minutes, God forbid in an hour, which is way too long. We're not requiring that. We are not requiring the physical presence ever. We're saying that somebody can sit behind a computer and literally run a code. And it's not possible. Your hands have got to be on the patient. I mean, I am so sorry to have to disagree so vehemently with this one. But I honestly think we can lower standards to the point where there is no purpose in having them. And this is just a line too far. It's a line too far for me, and it is a line too far for my medical colleagues. Thank you.
Senator from Bell.
Thank you, Mr. President. I rise in support of the bill. I want to talk a little bit about my short time down here. I learned real quick that, you find out real quick who's specialized in certain areas, and, and in this particular matter, I don't know that any of us here have any more expertise than the gentleman that's got 40 years in. I mean, when we talk about education, we look at the gentleman from Greene or the gentleman from Bourbon, or we can go right on down to energy to the gentleman from Perry and McCracken. And I learned real quick you turn to those people to learn. And then I learned we get bills brought to us from lobbyists, we get bills brought to us from friends, we pick up bills in committee, that's how we carry them. Then you get bills you're compassionate about. And I'm compassionate about rural Kentucky. And all my adult life, some may say it's only been 5 years, but I believe I've been an adult for 30. But I think everyone in here could probably say your adult life, all you've ever heard about doctor shortages. That's all I've ever heard my whole life. We've got to have more doctors. We've tried. We've done everything we can. I don't doubt that you guys that have been here a long time, you've probably heard it since you've been here. We've got to have more doctors. As elected officials, I doubt that anybody's sitting here today that hopes when they leave here, they don't leave some type of legacy, something that they did good. You know what? When I was mayor for about 17 years. I built fire stations, I bought police cars, fire trucks, built parks, did a lot of things. All those were good things. But I did something in 2018 that I thought I never would do in my lifetime. I bought my local hospital out of bankruptcy for $3 million. And for a small city like mine, that was a heavy load. Probably the hardest thing I ever did in my 17 years. The first thing I did, I laid off 100 people. You know who one of the first ones I let go? My mother. Kept 60 people to keep my hospital going. Then we tried to staff it. All of our doctors left, rightfully so. The rural health clinics picked them up. I love our rural health clinics. They're great. But they have taken all of our doctors. I still go to my doctor. I graduated with her. I think she's the best doctor in the state. I go to her. I see her. She comes in and sees me. Sees 40 to 45 patients a day. She treats me, walks out. I stand there with a PA. She charts. She writes my prescription. I get the best care. I don't know if I've been anywhere else I get any better care. We would love to have doctors. I've had people say, well, you got to pay them. Well, pay's not a problem. You know, we have other obstacles in Eastern Kentucky that other people don't face. I live in Eastern Kentucky because I love it. But we don't have some of the things you guys do in urban Kentucky. I think I can stand here today and say this bill that the gentleman from Grayson is trying to pass will never affect you all. Your all's hospitals are so aggressive and you want to be the best, you're not going to hire PAs in your trauma centers. You're not going to hire them but we need them. We need them in the rural parts. I've got a few statistics here that, and ironically, this came to me today, and it wasn't even about this bill. It was somebody else brought them to me. 94% of Kentucky counties face primary care shortages, with the Commonwealth ranking 40th nationally in primary care workforce. 48 Kentucky counties have no pediatricians. 8 Kentucky counties have no physicians at all, none. 107 of our 120 counties are designated health professional shortage areas. 33% of Kentucky physicians are within retirement age that have already served 31 to 50 plus years. Kentucky is projected to be 1,395 doctors short within the next 6 years, and 86,000 by the year 2036. 75% of doctors practice in urban area. We have 40% of the population in rural Kentucky and only 17% of the doctors. Is it too much to ask? Is it too much to ask for us to have somebody? I would much rather have a physician assistant when I go in that area than I had a nurse. My number one goal when I bought the hospital, you know, you lose your hospital, it's like losing your church, like you losing your school. It was the driver in my little community, was to get our emergency room going. It wasn't a joke every day, but it was how many choppers flew out today? 5, 6, 4. I live right behind the hospital. I could hear every one of them go out. It don't matter if it was 8 o'clock at night or 2 o'clock in the morning, it'd shake my house. But we saved a lot of lives. I actually had people come to me and tell me, I'm so thankful that you kept that hospital open. I CEO'd that hospital for 3 months. Never thought I'd be a CEO of a hospital. But we kept it going until we got it sold. My little hospital's doing good now. Thanks to you guys. You helped with it. Federal government helped with it. We have 3 doctors now, several NPs. It's doing good. I just think we owe it to our rural hospitals. I got 8 hospitals in my 5-county district. And we could save a lot of lives, guys. We can save a lot of lives. All we hear from our governor is how we're going to close rural hospitals. This is another tool for us to help keep our hospital open. He never fails to talk about how our rural hospital is going to close. Well, I'm not going to let them close in my district. We're going to figure out a way to keep them open. And I've yet to have one of the CEOs complain to me that their hospital is going to close. Here's an example of they're not asking for a handout, they want a hand up. They want a way to keep their hospital open. This is an issue that will affect rural Kentucky. I honestly wouldn't stand here today and say that if I thought it would affect you urban legislators. I urge you, I beg of you to strongly consider voting for this bill. Thank you.
Senator from Boone 20.
Thank you very much, Mr. President. I rise in support of this bill. I don't always support the senator from Grayson's bills, but I enthusiastically support this bill. And I want to, sometimes perfection is the enemy of the good. Yes, we would love to have every ambulance in the state have a physician in it. But you know what? That's not going to happen. And I want to tell a personal story about my son-in-law who stole a perfectly good Kentucky woman and took her down to Florida, where he was from. But he lived here for 2 years and courted her. And he is a ER PA, physician's assistant. He was trained in Florida. He worked for 5 years, I think, in rural Georgia, in a rural community where he gave service to get his school paid for. And then he came up here, and he began courting my daughter. And he looked, I said, okay, you're going to get a job in Kentucky. He could not get a job as an ER's physician assistant in Kentucky. The rules were too restrictive. We're very restrictive on physician's assistant. But he readily got a job in rural Ohio. He drove an hour from my house to go to work every day in rural Ohio. And he would work up there and he'd come back, he'd court my daughter. And we got together. One of the things I really loved to hear On Sundays, every week, every other week, we get together, and he would talk about the lives that he saved of rural Ohioans during that week. He would talk about the serious injuries that he diagnosed during that week, where he kept them from a lifetime of a crippling injury or saved his life. He was working in rural Ohio. I would love for him to have worked in Owen County or Carroll County or rural Kentucky. And if we had this bill in effect at the time he was courting my daughter, I would have heard week after week after week of rural Kentuckians' lives that he had saved. Rural Kentuckians who had been saved from serious injuries. But no, they're Ohioans. And now I can talk about a physician. He is from one of the most populated counties in Kentucky. And he works in a level 1 ER facility for that county. And after over 15 years of experience, he has new docs come in and talk to him if he's ever seen this happen on the floor. So we can talk about training, we can talk about education, but it's experience out there in the field. He has the experience to help the rural communities. And if he needs to talk to a doc, if he needs to consult, those docs are on the phone. He knows how to consult with the docs, and he knows how to handle those things. So I support the senator from Grayson's bill, and I hope that as we get these physician's assistants out into our rural communities, that they can tell their families about the Kentucky lives they've saved, about the Kentucky injuries that they have kept and not some neighboring states. We need this bill passed, and we need it passed as soon as possible so that we can get our Kentuckians the kind of rural health care that every state around us has. Thank you very much, Mr. President.
Senator from Davies.
Thank you, Mr. President. Rise in favor of the bill.
Please proceed.
This bill is not about Owensboro, Lexington, Louisville, Bowling Green, Covington. It's about our rural hospitals. My son-in-law is a nurse anesthetist, but at one time he was a nurse, and he flew on helicopters. And where'd they go? They didn't go to the big cities. They went out in the rural communities. If you were laying out on a hospital somewhere with a serious injury, you were darn sure happy that you got a helicopter came out there with somebody who was even a nurse, and because he was the only thing they had. And that's the problem we have now. Now, everybody in this floor just has seen a nurse practitioner or a physician's assistant. Recently, I had an appointment with a dermatologist. They called me and said, would you be willing to see the assistant? I said, yes. And you know what? When we need someone, we'll take the best we got. What member of this state Senate, if they have a family member injured in a highway accident out in a rural community, wouldn't want that person to be taken to the nearest hospital and see the most qualified person there? Hopefully, maybe it would be a doctor, emergency room doctor. But if it's not, I sure we'll all be glad to see the very best they've got to offer.
Senator, excuse me. First, I do have several people in the queue, and I'm going by the queue that is here. There is one person who has already spoken. I will not come back to them until I finish everybody who is yet to be recognized. So with that, I'm going to recognize the senator from Perry.
Mr. President, I stand to speak on the bill if I can. And
please proceed.
You know, as we stand in here today, I look at a lot of the new faces that have been here over the period of time that the Senate President and I and a few others have been here, but I think I have the distinction of serving the rural part of the state longer than anybody other than Senator Stivers, our president. But we've seen a lot of changes and a lot of needs in these hospitals over this time. But if you go back and you look and see at the hospital that covers the darkest area, if you will, of indigent care, in the nation. It's the Miners Memorial Hospital. Now, if you've never heard of that, that's because that hospital was created by the miners for them to be able to take care of their families, and they took the coal severance money that came from that region that fired the furnaces that got us through World War I and World War II, and is one of the third pillars in D.C. that holds up the entire economy. But these families were working hard day and night, but they didn't have the roads and the water and the level of care that they deserved. And so this hospital system was created. And so the Miners Memorial Hospital turned into what we now know as ARH. And they cover a region across eastern Kentucky that a lot of, honestly, medical facilities don't want. They'd rather not be down there because they have a lot of people that show up with a lot of very tough issues, and they don't have the money in a lot of cases to pay. So we've come up with a lot of different formulas over the years to try to help offset this with the indigent care so they don't collapse. Because should they collapse, I will tell you the fallout for that, it's something we're not ready for, and there is nobody fighting to get back into this region. Now, here's the problem, and I know this because my oldest son is a doctor. He works at the Jewish Hospital in Louisville, but he is from that region, and when he's home, he often works in the emergency room, and he has just signed a contract to go back to Pikeville. But the problem with it is that you can't hire enough people to come back into the region because a lot of times they don't want to. When you get through with your medical practice, you want to go to the beaches or North Carolina or wherever you want to go, and so it's tough to compete, and these places compete for that, but it's the doctor's choice in the end to go where they'd like to go. And so unless you're from that area or you've got family or you have a compelling reason to go back there, those numbers are relatively small, and then people go off to other places. So how do you get them? The rural hospitals have to come up with numbers to entice them to come, and a lot of times that's pay. You have to go out there and pay them, and then you have to figure out, is there enough money to actually cover this and all the services that they bring? But even with that, and we've seen the pay offered, they still won't come. And so we've addressed that with different ways. We've had a lot of doctors that have come in from other countries to fill the void and such, but in the end, you still have people in this area that need medical care. And so we've gone through this whole story, and I did not mean to be so long, but it's because of the failing to be able to entice and bring people in, good, bad, or indifferent, that we're here. And so we have to find a way to get them the best level of care that's reasonable and what we can afford to do today. And what we wish we could do is add more doctors, as has been said here, but when we try that and it's failed, we got to back up and look at a way to make sure that there is personnel there that has the experience. And so I've looked over this plan several ways, and I think that does. It addresses a way for our hospitals to put people that have come from our military, that have seen a lot of combat experience that will be in there, that in a lot of cases are probably more equipped in some instances to see some of that triage than what somebody that may have gone through, and that's a pediatrician. So I do think it's a good measure. I think that we could come right back here in another 10 or 15 years with a very different picture, because I plan on growing Eastern Kentucky, so be ready. I'm going to come after your doctors in Louisville and Lexington, but as of right now, that's not the case. So I would encourage you to think this thing through and be thoughtful. I have voted for a lot of bills for Louisville, and I've stood back by and watched what you members vote for yourself, and then I've supported that. This is a case where we're asking a lot of our friends that are from urban areas to look and see what us rural legislators do, and then we're asking for that same kindness in return. With that said, thank you, Mr. President, for letting me speak.
Senator from Campbell.
Yes, Mr. President. Will the bill sponsor answer a question?
Senator from Grayson, will you yield to a question?
Yes, Mr. President.
Senator from Campbell, he will yield.
Yes, if we currently have a rural hospital that is not level 4 verified trauma center, what would a hospital, in the event that this bill passes, what would a hospital be expected to do to become a level 4 trauma certified hospital?
Senator from Grayson.
Thank you for the question. There are several steps they have to take. One is adopting protocols that's specific to trauma-related injuries. Secondly, they have to train their personnel, again, in trauma. There's a nurse designation, a course they have to take. Also, you have to have certain life-saving equipment on hand that you don't have in just standard ER. And you have to have transfer agreements, formalized transfer agreements with larger tertiary care centers. So again, it just positions them to have the skills to do as they're expected to do, assess the patient, stabilize them, transfer them.
Senator from Campbell, you have further need.
Yes, a follow-up question, please?
Senator from Grayson, will you yield to another question?
Yes, Mr. President.
Senator from Campbell, he will yield.
Thank you, and I acknowledge that I'd like to see the best-kept secret of Kentucky, which is our rural, beautiful Kentucky, to be prosperous. And I think of many of our children that are passing through and maybe involved in some sort of a horrendous auto accident. What sort of pediatric care would a level 4 verified trauma offer?
Senator from Grayson.
Excuse me, Mr. President. If they have the luxury of having a pediatrician on staff, I assure you that pediatrician would show up in that ER. That's the way it works in rural communities. I mean, we had a very terrible accident in my home county. It's been, gosh, maybe close to 20 years ago, where an elderly man ran over a couple of children leaving church. No fault of his own. He just hit the gas when he thought he was hitting the brake. And every member of my medical staff showed up in that ER because that's what rural communities do. So if they had a pediatrician, I guarantee you, even though he's not there in the ED, he'll come from his office to take care of that patient. Aside from that, again, within our best capabilities, they'll stabilize the patient and transfer them.
Senator from Campbell, further need?
No, that sealed the confirmation of my support for this bill. Thank you, Mr. President.
Senator from Jessamine, I had seen you in the queue, but now I've seen it off. Were you seeking recognition?
Mr. President, I will have something to say, but during the vote. Thank you, Mr. President.
Any other member seeking recognition who is yet to be previously recognized? I see no one here. Senator from Jefferson 26 had asked to come back to her. You have used 8 minutes of your 15 minutes. Senator from Jefferson 26.
Thank you, Mr. President. You know, guys, we agree just about everything. We agree that access to good quality health care is essential for people's well-being. We agree that we want good quality health care available in all parts of the state. We agree that there are significant staffing shortages in the healthcare profession from top to bottom. What it means, guys, to be a level 4 trauma center is that the ambulance stops there. If you're not a designated trauma center, the ambulance goes on to the next closest trauma center. There are EMTs in that ambulance who are as trained as the PAs that you are going to ask those EMTs to drop that patient off at. No actual significant higher level of training there. Why are we putting people at risk? And guys, honestly, if this is an absolute essential need for Appalachian Regional Healthcare, then why don't we limit the bill to Appalachian Regional Healthcare? Because I promise you, we pass this bill and every level 4 trauma center in this state will no longer have a physician. They will have a PA because it costs the hospital less money. They have to put out less for a PA than they have to do for an MD. And so they're going to do that. We did that with the advanced practice nurse practitioners. We expanded their scope of practice, and now every hospital is hiring nurses in lieu of physicians. And it diminishes the quality of patient care. And actually, guys, ultimately increases the cost of care. It is a less efficient, less effective way of delivering health care. There is, there are other options. There are alternatives. I have had representatives from both UK and U of L departments of emergency medicine tell me they would be happy to step in and help. Maybe we could do like what we do with our residents and send them out to like Trover Clinic for 3 months. We could put serious advanced level third-year residents and put them in these emergency rooms, and your patients would be much safer. There are other choices. We do not have to diminish the quality of care to figure out an answer to this problem. If it's your family member, think about whether or not you personally would be willing to pay the cost of having a trained emergency physician respond to your child's life-threatening car accident than to have a physician assistant that doesn't even have requirements. There's no certification for this position. There's no way to even document that they're trained. I'm sorry, it's just not safe. It is not what you want in that situation. I know you all feel that you're in a backed up against the wall. You have no other choices. It's not true. It is not true. It is not true, guys. This state has enough money to adequately finance a viable, healthy, quality healthcare system for its constituents. And I'm sorry, but this is just too far. It's too far. It is too life and death. Time is too short. There is no room for mistakes. You make a mistake and somebody is permanently injured or dead. It's not like you're going into your primary care physician's office with a cough. That's not what these trauma centers do. That's not who shows up at the door. And that is not the response they need. Thank you.
Senator from Jefferson 35.
Thank you, Mr. President. May I speak on the bill?
Please proceed.
When I came in today, these chambers, I was a for sure no on this bill. And as I've listened to debate, some folks have made some very strong arguments as to why I should be a yes on this bill. And then I decided to look through my emails to see if anyone has said anything about this piece of legislation. And I've actually only gotten 2 communications from constituents, and one told me to vote yes, and one told me to vote no. And I also sit here today on the floor, and I'm drinking my hot tea out of a mug that I got at the opening of the Norton West Louisville Hospital. And for those who don't know, and of course people in this body, a couple of years ago, we ensured that the residents of Louisville, particularly in West Louisville, had access to a hospital, which those residents had not had a hospital in over 150 years. And I honestly don't know on this particular legislation in Senate Bill 12 if I'm going to be a yes or a no. I still don't know, and I'm probably not going to know until I say whatever it is. But I just stand up to say that oftentimes we are here in this body and we don't have all the information, or we get some type of information, But then there's also this moral tug that we have within ourselves that help us decide what we should do in taking this vote. And so I do appreciate my colleagues from our rural areas to have given their compelling testimony or their arguments about why we should be in support. But I do have one question. If the gentleman from Grayson would yield, just so I can get clarification to hopefully help me get to an answer shortly. If he would yield to a question.
Senator from Grayson, will you yield to another question?
Yes, Mr. President.
Senator from Jefferson 35, he will yield.
Thank you. Senator, can you help me understand when we're talking about these trauma for centers? Can you talk about what the difference is in the equipment? I know that we've had a lot of conversation about the individuals and the physicians who would be there responding or having supervision, but can you talk a little bit about, is there a difference in equipment that is going to be at the hospital?
Senator from Grayson.
Thank you, Mr. President. I can to some degree, and sometimes it's not new equipment, it's having more of the same equipment, such as defibrillators. I'd imagine that you'd have to have scopes to open up the airway. That's very, very critical. And one of the biggest challenges ER physicians have is a patient will come in and their throat is closing up and have no way to open up the airway, so you have to have a special scope for that. Obviously, the defibrillators are important, equipment for transfusion of blood, things of that nature. So it's a multitude of factors, but it is an expensive proposition for rural hospitals.
Senator from Jefferson 35, do you have further need?
Yes. Will he yield to just one more clarifying question?
Senator from Grayson, will you yield to one more clarifying question?
I'll be happy to, Mr. President.
He will yield.
Yes, Senator. So when we it's about the equipment again. So when we talk about the equipment, so if we look at a trauma for hospital in an urban area, would this rural hospital then have the same equipment that rural that the urban trauma hospital would have?
Yeah, remember,
Senator from Grayson.
Sorry, Mr. President. Remember that the trauma 4 designation, those standards are standardized for every hospital, if it's urban or rural. And you have to have people come in to do inspections and make sure you got the procedures in place, policies in place, but the equipment will be virtually the same.
Senator from Jefferson 35, do you have further need?
I do not, but I still do not know how I'm going to vote.
Any other member seeking recognition who's yet to be previously recognized? I see the senator from Jessamine.
Speak on the bill, Mr. President.
Please proceed.
Thank you, Mr. President. I speak sort of just for informational purposes. Everyone has an idea of how they want to vote, most everyone. But I just want to give you something from the perspective, one of those old guys who just got scared when I started calculating. I've been in the healthcare space for 46 years, Mr. President. 46 years, which is why my hair is thinning. We always talk about how Kentucky is 23% worse than the national average when you look at the number of physicians to population. National average is 247 physicians per 100,000 population. We're horrible, folks. Instead of being 247, we have 242.6 doctors. So the doom and gloom is not there per 100,000. I'm not saying that we have enough, but I hate it when they always paint the picture with doom and gloom. The truth is, whether you're a doctor, a physician, an MD, or whether you're someone who's a nurse practitioner, or whether you're someone who is a physician assistant, you're still going to try to seek the best environment for yourself. So this idea that someone paints of, we'll get all these great nurse practitioners who know all this great stuff, and they're going to go out into these rural areas, you're kidding yourself. They're going to react like everyone else. They're human. And we've got to give them that grace. So let me just share a few concerns. I'm not trying to change anybody's mind. I respect everyone in this room and your ability to think. But I just want to share a few concerns. And those are the concerns that physicians in general have now, because I've met with a number of physicians over the last 3 days in my office here at the Annex. Physicians are really concerned about the constant expansion of privileges and the lowering of standards in the healthcare space. You know, there's no doubt that we have certain people in the healthcare space that can perform some of the activities that doctors do. None. I don't challenge anybody that. Does that make them equal? I don't think so. But every time we expand privileges, I want you to think about what you are telling your healthcare providers at the tip of the spear. Now, I'm also concerned about this idea of telling our rural areas that they should settle because we, as a General Assembly, aren't willing to do the things that we need to do to help fix the problem. Are we telling them that they're not really worthy of a MD? And we can tell them that by saying this nurse practitioner or this physician assistant, they can do the same thing. I mean, you know, they really can. No, they can't. I'll tell you why they can't. Because if I'm walking down the hall in the hospital and I'm walking beside a nurse practitioner and that little blue light goes on for a code, who do you think they're going to call? I can tell you who they're going to call because I've been there at all hours of the day and night. You know, medical doctors in all specialties, this might be new for you all, but they're feeling disrespected and they're feeling devalued. We let other people creep closer and closer to having the privileges that we work so many hours to have, that we take so many tests to have. I still remember the second week of medical school when our professor said, you know, you all have a really smart class. We've looked at all of this stuff, which made me wonder why I was there in the first place, right? It did. And they said, we're gonna test you guys not over what we present in class. We're going to test you guys over anything that is in the books, that is in research, or that is being thought of. And if you think I'm kidding, I'm not. That's the way it is. So let's not sit here and try to equilibrate things. We've got different issues that we're talking about. We're talking about trying to provide good care in certain areas that don't have that care. But make no mistake about it, I will always stand up and say that if you're going to equate the other levels of health care to the health care and the training that we receive at our level, you got your head in the sand. You know, we've got to decide whether we're going to start really talking about whether we don't have enough physicians or whether we have a true maldistribution of that population. And if it's the latter, elevating people above their privilege level doesn't help improve patient outcomes. I'm just a dumb old doctor. I may not know a lot, but I can guarantee you something. I care more about patients, all patients, than anybody in this room today. Because I've had to be in the emergency room, not knowing what's coming through the door. I've had to go into those small rooms with mom and dad and 6 and 7 other people and tell them that their 21-year-old son didn't make it. their 21-year-old daughter didn't make it. You know, when people walk into a trauma center, do you think they think at the level we do here? Now, when people walk into a trauma center, they expect to see a physician. I'm not saying that's right or wrong. I'm not trying to change anyone's vote. I've told you that before. We have designations for things for a reason, and it's because of public expectation. Why do we have designations if we're not going to live up to those designations? You know, there really are things called emergency rooms. I don't know whether you guys know that, but there are. And finally, Mr. President, you know, I think that we really should consider, and my good friend from Grayson 5, and I agree with him. I agree with him wholeheartedly about the destination. Wholeheartedly about destination. But we talk about some different pathways. And you know, we should explore more highly payment parity, or even enhance reimbursement, the way we do through our tertiary care centers. We need to help replenish our healthcare deserts. And we need to replenish our healthcare deserts the same way we replenish our urban areas, because those people are just as important as everybody sitting in this room today. You know, I always think about what my good friend from Marion 14 says, and it's about the process. It is about the process. And whatever we vote today, I'm going to respect everybody in this room, because this still has to go over to the House. And the House is part of the process. So what I would encourage my fellow senators is that no matter what happens with this bill today, that we all come together and that we all stay together as we have been in the past, because our job is to serve the people of the Commonwealth. It's not to get a win. Thank you, Mr. President.
Any other member seeking recognition that has yet to be previously recognized? I see no other person seeking to be recognized. Senator from Grayson, do you have a final comment?
I do, Mr. President. Appreciate the discussion. I'll go back to one of my original comments. In the 9 years I've been here, I have provided measure after measure after measure that would improve health care, reduce bureaucracy, increase access to care, and they don't go anywhere. And they predominantly impact rural communities. You know, and the biggest divide we have here is not political any longer. I look at the senator from Jefferson 33. We talk frequently about what can we do to help the poor in our respective districts. The biggest divide we have now in this legislature is urban versus rural. And quite truthfully, the scenario that the senator from Jefferson 26 presented, I'm appalled by. Because you don't understand what it's like to live in a rural community. In a small community, if you have a hospital, it's the center of the universe, the healthcare universe. People don't think, is this a level 1, level 2, level 3? No, they think, that's the hospital. That's where they take care of you. And when you cough, kids start coughing, you take them to the hospital because you can't get in a primary care clinic. You cut your hand, you go to the hospital. You break your arm, you go to the hospital. Even though they have an orthopedic surgeon, you go to the hospital. And I guarantee, if you have a car wreck and you're waiting for an ambulance to get there, there's a good chance they're not going to be there. So you're going to take them to the hospital. That's what these 55 hospitals that don't have this designation do, and they do it to the very best of their ability. And to suggest that it's better health care to be in an ambulance or rural community where you have people who only have basic life support training, who may be on the job for 2 weeks, is better than a ER nurse? That's ludicrous. That is absolutely ludicrous. And if your solution is just get in your car and drive up to the big regional miracle center, that's unreasonable. Totally unreasonable. It's unrealistic. Some of our counties are huge. I've got one in my county, it takes an hour to go from one end to the other. And for an ambulance to get to point A to point B, it takes forever. You don't want them at least to have a fighting chance in the hospital to take them there and try to stay involved. Don't suggest just because they don't have trauma training to the degree that you want them to, that they can't take care of that patient. Because I guarantee you, we've got one thing that most urban hospitals don't have, and that's compassion for the people we take care of. Because any patient who comes to our ER, it's a family member, it's a neighbor, it's someone he worked with. We take care of those people to the best of our ability. We're not going to shortchange them. And this doesn't shortchange them. It gives those 55 hospitals the opportunity to get some additional funding to do the very things that we expect of them, to move them to the next level. And the solution you've proposed, it's the same thing. It's just, that's not a solution. In theory, great, but it's not a solution. And that's what I've heard from everybody who's against this. We don't need this. Then tell me what works. What does work? I'll give you a solution. Fair pay. We don't get that. Our reimbursement in rural hospitals is significantly less than urban centers, but we expect to be held to the same standard of care? Where's the hypocrisy in that? We want the highest level of care for our people in Kentucky, but we've never funded the trauma network that we established in 2008, and we've got 5,000 people a year that are dying, mostly in rural communities. I know this is not the ultimate solution. I would like to have an ER doctor in every hospital in the world. I'd like to have a primary care doctor in every county in Kentucky, but they're not coming under the current situation. And to ask us just to wait for health care or drive up the road, that's unreasonable. It's not fair. It's terribly unfair. And that's all we're asking is let these hospitals have some additional resources so they can lift themselves up to be the best that they can be. That's all this amounts to. It's not replacing doctors. I had this conversation with my son yesterday, which is a doctor. We talked about this. I mentioned when I met with the group of ER physicians, they expressed that same concern. Well, we're afraid that these level 4s will replace the doctors with a nurse practitioner. Really? I mean, you're lucky to have a doctor to begin with. But if that were to happen, I told him in his specialty, he's double boarded in family medicine, sports medicine. You can quit your job today and you'll have one tomorrow. That's every doctor in this state. But they're not coming to rural Kentucky because we're second-class citizens, and I'm tired of being treated like a second-class citizen. This is a reasonable measure, does not compromise care. In fact, it elevates it to a level, at least in these communities. I can't even believe we spent almost an hour on this discussion because it's common sense. It's not a perfect world. But if we're waiting for the perfect solution, it'll never come. You know, it's amazing that the same time I filed this bill, the American College of Emergency Physicians, their chapter here in Kentucky, are pushing a bill over in the House, House Bill 107, to require a board-eligible or board-certified emergency physician in every ER in Kentucky. You know what would happen if that would pass? You close every hospital in Kentucky, at least rural. Then what do? You know what the average salary of an ER physician is in this country? $375,000. And they earn every cent of it. But God, to add that additional expense, the hospitals are already struggling. They're just trying to survive. That's unreasonable. I'm taking theory and matching it with economic reality. This is the best we can do. It's not perfect, but it's better than what we have now. Thank you, Mr. President.
Okay. Senator from Jefferson 26, you are seeking recognition. You have used 14 of your 15 minutes under the rules, so you have 1 minute.
Sir, I will speak quickly. Senator from Grayson, sir, you just spoke the truth. Because level 4 trauma centers can charge more for their services than if they are not designated as a level IV Trauma Center. So you want the hospitals to be able to charge higher rates, ostensibly for a level of service that they do not have to provide. I'm sorry, if it's better than nothing, then let's limit it to the regions that you say are this desperate. Because it's not better than nothing for the rest of the state, where the goal is to have survival rates that are high, where people get hurt and they survive. That's not what's happening in your region, and you know that. The death rates are much higher. And we're going to make that worse so that the hospitals can charge more. I'm sorry, no, I'm not, no.
No.
Okay, now we have more people in the queue. I'm going to go back to the senator from Boone 20. And Senator from Boone 20, you only used 3 minutes and 45 seconds of your time, which
Mr.
means
President,
you have 11 minutes and 15 seconds.
I'll use less than 1 minute. I just want to say that a physician's assistant or an practical nurse that we're talking about in this program is more highly trained than just a normal nurse. And they are trained in emergency medicine. So this is about getting somebody in the job that has been trained to do it, and not only trained to do it, has the practical experience to do the work that they are going to get paid for. A regular nurse does not have the training that they do. So I am still for this, and I urge everyone to vote for this particular bill.
His name in the queue, nor standing to be recognized. The matter for the body is passage of Senate Bill 12. All those vote that are for it, yea. Those opposed, nays. Madam Clerk, please call the roll.
Senator Berg.
Nope.
Senator Boswell. Senator Carpenter. Senator Carroll.
Senator from, I always have to change on me every now and then, McCracken, please cast your vote, then explain, limited to 3 minutes.
Thank you, Mr. President. I would like to cast an aye vote and explain. I came into the session today expecting to vote no on this. The senator from Grayson, the senator from Bell make compelling arguments. And, you know, it's a sad state that we are where we are, that we're having to make these kind of decisions in our state. And the best we can do is to make decisions in situations like this that we believe will save lives. Am I comfortable with where we are on the expansion of scope of practice in several different areas? Very uncomfortable with that, as I think most of us are. But we are in a situation that we have to make do with what we've got. And it is truly my hope that the decision that's made today, if this bill goes forward and becomes law, that it will lead to saving lives. And I hope that we're able to, in some capacity, in the near future, address these issues and make decisions within this body that attract physicians to this state. There is tort reform that is needed. There are other areas that we can address that will solve these problems. And instead of putting ourselves in these situations to make no-win decisions, we need to be solving the problem. That's why our people send us here. This is a problem we can solve. We have to make this state a place where physicians want to live, want to spend their career, make it an environment where they can succeed in their practices. The direction that we're going, the process of physicians not having individual practices anymore, becoming employees of hospitals. My experience with that is I don't like it, and it doesn't work. It's not providing proper health care for our people. The quality is down, the ownership and care, because you have your own practice, it's not the same. And we need to start thinking about where we are, not just as a state, but as a country, and this goes on up into the federal delegation, and we need to start solving some of our health care problems. We have backed ourselves so far into a corner by a lack of action in this country that we're facing crises because of the lack of decision-making at a federal level, and we need to do what we can do as a state to solve this problem. Thank you, Mr. President.
Senator Chambers Armstrong. Senator Clemens.
Senator from Jefferson, 37, please cast your vote, then explain.
I would like to cast my yea vote and explain for one, the compassion that I've heard today from colleagues today, especially Senator from Grayson. And I just want to move this forward to try to work it out. But then also the passion from my colleague to my right here, and also realize that where I come from dealing with major corporations is if this does get passed in the big cities, if you want to call us a big city, I'm afraid of corporate cuts. So I want to help move this forward to maybe work out some more details. And I just want to thank everybody here for y'all's compassion on the conversation, the debate today. So thank you.
Senator Deneen. Senator Douglas.
Senator from Jessamine, 22. You still have a full 3 minutes in which to explain your vote. Please cast it, then explain.
Thank you, Mr. President. Mr. President, I'm going to pass on this vote. And some people want to know why I don't pass very much, but my good friend from Grayson 5 is right. He's right, which is why I said I don't want to change anyone's mind. You're adults in the room. We all read, and we all try to learn. But you know, Mr. President, I told you how long I've been in health care, and I'm a physician, and I want the highest level of care for everyone, regardless of where they reside. So I'm not voting against the bill. I just have a different perspective, and it is my hours of training and the hours of sleep that I've lost over the years that moved me in that direction. Thank you, Mr. President.
Senator Elkins. Senator Funke Fromeyer. Senator Girdler. Senator Givens. Senator Herron.
Senator from Jefferson, 35, please cast your vote, then explain, and you have your full 3 minutes still available to you.
I am going to be an aye vote today. And and I would just like to say that, as I said before, I think that this is a huge issue, and it's not just about this bill. It is about our healthcare system altogether. And so, as my colleague said, I am going to vote yes to move this forward. However, I will be keeping a very close eye on the impacts that this bill has. And if this bill has a large negative impact on our Commonwealth, I will make sure that I am one of the main people to fight to repeal what we are doing here today. Thank you.
Senator Higdon.
Senator from Marion, please cast your vote, then explain, limited to 3 minutes.
Thank you, Mr. President. I would probably never use 3 minutes explaining my yes vote, but I did want to commend the senator from Grayson for his passion for not only his constituents, but for rural Kentucky. I also want to commend the senator from Bale for his explanation and about how important a hospital is to a community in rural Kentucky. It is a lifeline, and I wanted to appreciate that. And I really appreciate the senator from Jefferson 35 for coming today on the Senate floor not knowing which way she was going to vote and listening to the debate and making the decision to vote yes. Thank you. Thank you, Mr. President.
Senator Howell. Senator Maiden. Senator Mays Bledsoe. Senator McDaniel. Senator Meredith. Senator Mills. Senator Neal. Senator Nemes.
Senator from Bullitt, please cast your vote, then explain. And still
Thank-
limited 3 minutes.
Thank you, Mr. President. I want to explain my aye vote. As we listen to both sides and all the ramifications and maybe unintended consequences, this is needed now because this is something that is, people are literally dying. There are no level 4 trauma centers, or very few out in the state, and this bill will help them put in a trauma center, and at least the healthcare workers there who may not be doctors are as qualified. They can take care of you, patch you up, and they'll have more equipment and expertise to do that, to send you on. This is not a level care issue. It's some trauma care or no trauma care. So I do see, and this is a little different than I've always stood behind the doctors, because this is a future problem by giving the people that aren't doctors better, more qualifications. Because why do you want to be a doctor if you can get paid the same doing something else? It is incrementalizing people to move forward when they shouldn't. So we need to make, this body needs to make sure we do something to get doctors in this area, in Kentucky, and not just in the larger cities. So my vote is aye.
Senator Nunn. Senator Rocky Adams. Senator Rawlings. Senator Reed.
Senator Shelby, please cast your vote. Explain, limited to 3 minutes.
Thank you, Mr. President. I'd like to cast a no vote, and with all due respect to my colleague from Grayson, who's put in a lot of effort and a lot of leadership in this, I do vote no as a point of honor and keeping my word to my constituents and my doctors in my district. You know, I want this no vote not to be against the senator from Grayson's bill, however, more of a flag that we're waving, that a reminder that this is America and we are the tip of the spear in, you know, for the rest of the world on what a doctor is and what it should be. And I just want that to stand out, that we shouldn't lower our standards. I realize the point of this bill, and I realize that a no vote is going to probably be insignificant in how this bill turns out. But I just want that to stand out as a point to remind the rest of us that this is America, and American exceptionalism is very important to me, and that's why I vote no today. Thank you, Mr. President.
Senator Richardson. Senator Smith. Senator Stivers.
Senator McGinn, could you assume Chair will explain that vote?
Senator from Clay, you're recognized for the purpose of vote explanation. Please cast your vote first and explain within the allotted time.
Thank you, Mr. President. I've hit my reset button, so I know it's 3 minutes. I didn't think I was going to say anything about this, but there is great passion about this, and I vote aye, and this is the reason I do. It's a question sometimes of quality of care or access to care. So one of the fortunate things in the position I have access to information. We have 2 level 1 trauma facilities, one being the University of Kentucky, one being the University of Louisville. I'm not going to say who I talked to because I don't want to expose what was said to me and breach confidences. But this concerned me, this bill did. So I reached out. to the individuals who, at the two most highly accredited institutions facility for trauma, the only two, because there's only another level 2 at Pikeville Medical. I said, so what do you think about this? Their comment is, we understand the arguments, but we can't argue against the bill. It's access to health care, not the quality, but just having access, and we cannot argue the merits of the bill. I may have should have said this earlier, but this is something I felt I needed to say now after hearing the passion and the comments here. The 2 level 1 trauma units in our state cannot argue the merits of this bill.
Senator Storm. Senator Thomas.
Senator from Fayette 13, please cast your vote and then explain within the allotted time.
Mr. President, I'm reluctant to cast a no vote. And I think this debate today reflects both the seriousness in which we take our position and the reflection of the fact that we all recognize that our healthcare system is just broken. And we've got to take some very serious steps to correct that. We're going to discuss later on in this session House Bill 1 and House Bill 2 that are going to revisit this issue about how much money and how serious we are about doing what we need to do to improve our healthcare system. I voted in support of SCR 9, and I told the senator from Grayson then, I thought that was an excellent step in the right direction in terms of addressing the problems we have with our healthcare. And I think I would like to see more bills along that line of Senate Concurrent Resolution 9 in terms of addressing our healthcare system. But I vote no because this bill really does not provide the kind of quality of care that we really purport to need in this state. And I'm saddened by that because it is a funding issue. And so therefore, I vote no on Senate Bill 512. Thank you.
Senator Tishner. Senator Webb. Senator West. Senator Wheeler.
Senator from Pike, please cast your vote, then explain, limited to 3 minutes.
Mr. President, explain my aye vote. I don't think you could really sum it up much better than the senator from Grayson, the senator from Bell. Obviously, we'd all rather have a physician, I think, under most circumstances in the ER, but when they're not available, you want somebody there with some medical knowledge and training to serve you in your time of need. And I think something else that needs to be looked at, I recently have known of a couple children you said children, I guess I've known them most of my life, but attended medical school, and had a desire to attend medical school at one of our state universities, had great scores, pretty decent MCATs, but they don't get in. So, and I know these are competitive slots, but, I think we really need to have a discussion, especially when it comes to kids from rural areas. Should they not get some preferred access before we start taking people from out of state? Because, those people are more likely to go back home and practice than, somebody coming in from Illinois or somebody coming in from California or somebody coming in from Virginia. We got Kentucky universities, Kentucky medical schools. They need to be taking Kentucky students. And they need to be prioritizing Kentucky students. They definitely need to be prioritizing Kentucky students from rural areas. So again, Mr. President, it's been said many times, let not the perfect be the enemy of the good. This is a good bill and it needs to pass. Thank you.
Senator Williams.
Senator from Boone 20.
I won't
have your
3
full
minutes.
3 minutes.
Thank you, Mr. President. This is a good bill. And I don't see the conflict between physicians and physician's assistant. I mean, a physician's assistant or the nurse practitioner that's in there is just an extension of the training, the eyes, the ears, the hands of that physician. They are being overseen by a physician. That's what they're trained to oversee them. The physician's assistant is trained to rely upon the physician. So this is just a more effective way of delivering health care to a location or where a physician is not available. And this can actually even happen in the urban hospitals when they get overwhelmed and a physician assistant or nurse practitioner has to do the work because the physician on call is tied up in another location. This is an extension. So I vote yes because I do not see this as a conflict between physicians and physician's assistant. And quite frankly, we are never going to have enough physicians in this state. I mean, maybe you can dream about it, but that's not the reality in the immediate future or probably even the near future. And we have to do what is the best that we can for every citizen in every place in the state. So I proudly vote yes.
Senator Wilson.
Senator from Warren, please cast your vote, then explain, limited to 3 minutes.
Thank you, Mr. President. I vote aye. And I remember when I first got elected and I came into this body, the former senator from Fayette 12 had some advice for me. She said, yes, you've been elected from your district to represent your district, but never forget the fact that you are a Kentucky state senator. Said you will be faced with decisions that affect the whole state. You can't always vote your district. I have 2 great hospitals. I live in this 3rd largest city. But I do have some rural counties that have rural hospitals. And so for me, this is something that I think that I cannot vote against because they need that level of care. And so I proudly vote aye for this bill as a Kentucky state senator. Thank you.
Senator Wise.
Senator from Jefferson 33, do you wish to cast your vote?
No.
Any other member seeking recognition to cast, change, or explain their vote? Senator from Jessamine 22.
Change my vote, Mr. President.
Please proceed.
I'm going to change my vote to a no. And again, I understand that my perspective is different from my colleagues. I understand that there are some who don't understand that a trauma center is different than going to the office during the day. And that's really why trauma is not just regular clinical care. But I think to be true to my colleagues in the healthcare space, that's what I need to do. Thank you, Mr. President.
See no other person seeking recognition, there being 27 yeas, 11 nays, Senate Bill 12 is passed. Senator from Taylor.
Mr. President, we're going to pass over Senate Bill 34, but I ask that it retain its place in the regular orders.
Without objection, Senate Bill 34 shall be passed over and it will retain its place in the orders of the day. Senator from Taylor.
With that, Mr. President, that concludes the orders of the day.
Senator from Taylor, do you have a motion?
I do, Mr. President. I make the motion that the Senate recess for a meeting of the Rules Committee and the Committee on Committees at the clerk's desk, please.
This body shall be in recess until call of the chair.
Senate will come to order. Next order of business is report of committees. Mr. Clerk, please report.
Rules Committee has met and posted the following bills to the regular orders for Friday, February 6, 2026. Senate Bill 18 and Senate Bill 132. Also, the Rules Committee has recommitted the following bill to the Rules Committee. Senate Bill 34 recommitted to Rules. The Committee on Committees has met and referred the following resolutions to Judiciary, Senate Joint Resolution 74, and to the Senate floor, Senate Resolutions 76 and 77.
Thank you, Mr. Clerk. The next order of business is motions, petitions, resolutions, communications, and announcements. Members seeking recognition under this order of business, please push your button to appear in the queue. Senator from Oldham 6, what purpose?
An announcement, Mr. President.
Please proceed.
The Kentucky History Caucus is invited for a reception tonight to highlight the screening of the American Revolution in honor of America's 250 years. There will be a reception at 5:30, and then the viewing will be from 6 to 7, and it is at the History Center on 100 West Broadway in Frankfort.
Thank you, Senator. Senator from Campbell, what purpose?
An announcement.
Please proceed.
Yes, today is Thursday, might I remind, and then the morning will come rapidly Friday, 7 a.m. to 9 a.m. Our Kentucky State Police Professional Association would like to invite us for breakfast in the cafeteria.
Thank you. Members, please take note. Senator from Hardin, what purpose?
Co-sponsorship.
Please proceed.
With permission of the primary sponsor, I move to be added as co-sponsor of Senate Bill 153, and I have the proper paperwork.
Thank you, sir. Senator from Warren, what purpose?
Act on a resolution, Mr. President.
Please proceed.
Mr. President, could you have the clerk report Senate Resolution 52 and read it in its entirety?
Mr. Clerk, please report Senate Resolution number 52 and report that resolution in its entirety.
Senate Resolution 52, a resolution recognizing July 11th, 2026 as Remember Srebrenica Day in Kentucky. Whereas the members of the Senate acknowledge the valuable role and substantial impact Bosnian immigrants have in the Commonwealth. Whereas the massacre in Srebrenica in July 1995, which resulted in the systematic killing of over 8,000 Bosniak victims, has been recognized as an act of genocide by the International Criminal Tribunal for the former Yugoslavia. And whereas Kentucky has become home to many Bosnians who fled due to the war and ethnic cleansing that took place in the 1990s, and who have become integral members of the communities in the Commonwealth. Whereas many members of Kentucky's Bosnian community are survivors or descendants of survivors of the genocide, carrying with them memories of unimaginable loss and pain. Whereas the Commonwealth of Kentucky seeks to promote awareness of genocides, support educational efforts, and foster a commitment to preventing similar acts from occurring in the future. And now therefore be it resolved by the Senate of the General Assembly of the Commonwealth of Kentucky, the Senate recognizes the importance of acknowledgement and remembrance of such atrocities by honoring the victims and ensuring that such events are never forgotten. The members of the Senate hereby recognize July 11th, 2026 as Remember Srebrenica Day in Kentucky.
Senator from Warren.
Thank you, Mr. President. It's my honor here to present this resolution here today with so many of the citizens from my community that have immigrated to the community of Bowling Green from Bosnia, and that many are survivors of this very atrocity that we're talking about. And the Remember Srebrenica Day, July the 11th, has taken place in our community, and they have a walk to remember Srebrenica Day. And I've been privileged to walk in that walk with them. I felt very unworthy, but they wanted me to walk up front with the survivors as they carried the banner. And I felt very honored to do that, and I'm very honored to have them here today. They immigrated to the United States as refugees. They came here legally, and they have been great, great citizens. And I would love to tell you that some of those that are here today, and that I had the privilege to introduce a few in our caucus this afternoon, and I would talk about how they came to our community and did not even speak the language, but yet learned the language, became business owners, and became involved in the community to such a degree in all different aspects. We have several different sheriffs, deputies now that are from the Bosnian community. And our sheriff actually was in the military and helped discover some of the mass graves while he was in the military over there as a result of this atrocity that had taken place and the genocide that was there. But I would speak about some of those that have been so successful here, and all of them have just done a great job and have been such a plus in our community. Think about Tahir Zukic, who is here today. He came and did not even speak the language, but he could drive a truck. And he began driving a truck, and his wife, Amira, they worked together. Today, he has Taz Trucking. He has 150 trucks. It's hugely successful. Or I could speak about Kenan Mujikonovic, who actually went to school with my daughter, my youngest, and graduated with her, and then went on and graduated from college and law school, and now has his own law practice, who's here today. Or I could talk about Sasha Mandrapa, who I don't know if Sasha's here today or not, but he owns about 5 or 6 restaurants in Bowling Green. And I'll tell you, the food is outstanding. It's some of our favorite restaurants that we love to go to. They are in real estate. They are in every aspect of our community and have assimilated and become Americans and are so proud to be Americans and be a part of this country, a part of our community. And I'm so honored to be here to remember Srebrenica and honor them. And this flower that I wear that's knitted right here is the Srebrenica flower, to remember what happened, that it may never, ever happen again, and thank them for being a part of my community. So with that, Mr. President, I would move for adoption of Senate Resolution 52.
Motion for the body is on adoption of Senate Resolution number 52. All those in favor of the motion for adoption say aye. Aye. Any opposed? The ayes have it. Senate Resolution 52 is adopted. Thank you, Senator from Warren. Senator from Davis, what purpose?
Co-sponsorship, Mr. President.
Please proceed.
With the permission of the sponsor, Senate Bill 5 and Senate Bill 73. And I have the appropriate paperwork.
Thank you, sir. Senator from Clark, what purpose do you wish to be recognized?
For the purpose of making a motion, Mr. President.
Please proceed.
Mr. President, please have the clerk report Senate Resolution 42 and read it in its entirety.
Mr. Clerk, please report Senate Resolution 42 and report that in its entirety.
Senate Resolution 42, resolution honoring AL 81 on the occasion of its 100th anniversary. Whereas the AL 81 Bottling Company was established in 1902 by George Lee Wainscott in Winchester, Kentucky. Whereas in 1926, Wainscott released the AL 81, originally named A Late One, at the Clark County Fair. And whereas AL 81 is one of the founding members of the Kentucky Proud program, which promotes Kentucky-grown and made products. Whereas the AL 81 family includes 120 employees who work and live in Winchester and the surrounding communities. And whereas every bottle of AL 81 originates from small batches of the secret family recipe, hand-blended by Fielding Rogers, a fourth-generation family owner, following his great-great-uncle's handwritten notes. Whereas AL 81 received the prestigious Bluegrass Steward Award in 2025, in recognition of its stewardship in Kentucky. contribution to the Kentucky Proud program, and its support of their employees and the Winchester community. Whereas as Ale 81 celebrates its 100th anniversary, it remains family-owned and based in Winchester, and holds the distinction as the only soft drink invented in Kentucky that continues to be made in Kentucky. And now therefore be it resolved by the Senate of the General Assembly of the Commonwealth of Kentucky, the members of the Senate hereby recognize and congratulate Ale 81 on its 100th anniversary and honor it for 100 years of growth and success.
Senator from Clark.
Speak on the resolution, Mr. President.
Please proceed.
Mr. President, while George Lee Wanscott established Ale 81 in 1902, he didn't actually introduce the drink that we all know and love today until 100 years ago in 1926, of all places, at the Clark County Fair in Winchester, Kentucky. Ale 81 is, as you heard, one of the founding members of Kentucky Proud. Ale 81 proudly employs 120 members of Winchester and surrounding counties that live and work and raise families in our community and in central Kentucky. This summer, a couple of people from this floor, this body, and myself toured Ale 81. We walked through the plant. Unfortunately, it was not open at the time. It was a little late in the afternoon while we were there. But I've been there also when they are open, and they proudly allow people to come in and go through their facility, see what they do, how they do it, and they'll hand you a drink right off the bottling line so you can have it. Doesn't get any more fresh than that. The only thing they won't do is show you the recipe upstairs. They'll show you where it is, but they won't let you see it. That recipe's been kept secret for a very long time. Just a few things, Mr. President, that I want to make sure that we remember. Ale 81 was founded right here in Kentucky. It was premiered here in Kentucky. It's a member of Kentucky Proud. Ale 81 is woven into our community and our commonwealth, and our community and our commonwealth is woven into Ale 81. Ale 81 is Kentucky Proud, and Kentucky's proud of Ale 81. I wish to wish them a happy 100th anniversary. Mr. President, I move for adoption of Senate Resolution 42.
Motion for the bodies on adoption of Senate Resolution number 42. Any member seeking recognition to speak or drink on the motion? Seeing none, all those in favor say aye. Aye. Any opposed? The ayes have it. Senate Resolution 42 is adopted. Senator, thank you, and share our congratulations on the 100th birthday.
Thank you, Mr. President.
Thank you, sir. Senator from Bell, what purpose?
Thank you, Mr. President. Sponsorship.
Please proceed.
With permission of the primary sponsor, I wish to be added to Senate Bill 97.
All the appropriate paperwork. Thank you, sir. She's right. She got you. Senator from Bourbon, 27. What purpose?
Co-sponsorship request, Mr. President.
Please proceed.
With permission of the primary sponsor, I move to be added as co-sponsors of SJR 68, and I have the appropriate paperwork.
Thank you, sir. Senator from Fayette, 13. What purpose do you wish to be recognized?
Co-sponsorship request, please, Mr. President.
Please proceed.
Mr. President, with permission of the primary sponsor, I move to be added as a co-sponsor of Senate Resolution 72, and I have the proper paperwork.
Thank you, sir. Senator from Laurel, 21.
Announcement, Mr. President.
Please make your announcement.
Mr. President, the Juvenile Justice Oversight Council will meet tomorrow in Annex Room 131 upon adjournment of both chambers.
Juvenile Justice Oversight Committee members, that council members, please take note. Senator from Taylor, what purpose do you wish to be recognized?
Announcement, Mr. President.
Please proceed.
Thank you, Mr. President. Senator from Warren gave his resolution about the Bosnian community that's visiting. There is a reception that's being held in room 125 in the annex for members as soon as we finish off the floor here. For those that wish to go over to room 125, there is a reception with the Bosnian community that's here for today. Thank you, Mr. President.
Members, please take note. Any other members of the body seeking recognition of this order of business? Seeing none, we will proceed to the next order of business, which is introduction of floor amendments. Mr. Clerk, please introduce any floor amendments to the members of the chamber. No floor amendments to be introduced today. Next order of business, introduction of new bills and resolutions. Mr. Clerk, please report.
New bills and resolutions. Senate Bill 164, an act relating to cannabis. Senator Clemens. Senate Bill 165, an act relating to preschool education programs. Senator Thomas. Senate Bill 166, an act relating to preschool education programs. Senator Chambers Armstrong. Senate Bill 167, an act relating to an income tax deduction for union and professional dues, Senator Clemens. Senate Bill 168, an act proposing to create a new section of the Constitution of Kentucky relating to the possession of cannabis, Senator Clemens. Senate Bill 169, an act proposing to create a new section of the Constitution of Kentucky relating to property exempt from taxation, Senator Reed. Senate Resolution 81, resolution urging the Kentucky High School Athletic Association to recognize girls flag football as an official sport for its member schools, Senator Chambers Armstrong. Senate Resolution 82, resolution recognizing February 11th, 2026 as Recovery Advocacy Day in the Commonwealth of Kentucky, Senator Herron. Senate Resolution 83, resolution honoring police officer Nick Wilt on the occasion of his retirement from the Louisville Metro Police Department, Senator Neal.
Mr. Clerk, that concludes your report.
It does.
Thank you, sir. Any member seeking recognition for the final order of business for this day? Seeing the next order of business is adjournment. Senator from Taylor, you're recognized for a motion.
Thank you, Mr. President. I move that the Senate adjourn until 9 a.m. Friday, February 6th, year of our Lord, 2026.
This Senate shall stand adjourned until 9 a.m. Friday, February the 6th, year of our Lord, 2026.